Hello, and welcome to the keynote address for the West Virginia Rural Health Association Conference. I'm Dr. Dreama Hill. I'm Vice President for Community Engagement and Development here at the School of Osteopathic Medicine. And I'll be facilitating this session. So I want to tell you some things about how we're going to do this. So all attendees' microphones are muted. So if you want to ask a question, please put it in the chat and do so as we go along so you don't forget it. And if we run out of time at the end, then we'll make sure we get those answers from Dr. Nemitz for you, and we'll get them sent out to you. If you're watching this on video after the conference has occurred and you come up with some questions, be sure to submit them to Kim or Rich at the Rural Health Association. You can find that contact information on the main site. And we'll be reminded 5 minutes, so we don't want to be rude. So 5 minutes before it's over, we'll be reminded so that we can close the session. All right, I want to introduce Dr. James Nemitz. He is the 7th president of the West Virginia School of Osteopathic Medicine. He's been at WVSOM for over 30 years. He's been in various positions here. He was the VP for Administration and External Relations, the Associate Dean for Preclinical Education, and a professor of anatomy for many years, and many students remember him for that. He has such a special relationship with our students. He received his BS degree in biology from Randolph-Macon College, his PhD in anatomy from the Medical College of Virginia, and he was a postdoctoral fellow in neuroscience at the Yale University School of Medicine. So I'd like to welcome Dr. Nemitz to talk to you now. Thank you.
Well, good morning, everyone. Thank you, Dr. Hill, for that wonderful introduction. It's great to be here, though I wish you all were here too, though I know you're out there virtually, and I really appreciate you tuning in. I hope you enjoy the presentation. Okay, so without further ado, I want to welcome you to the West Virginia School of Osteopathic Medicine in beautiful Lewisburg, West Virginia. We are truly honored to be hosting the annual West Virginia Rural Health Association meeting here in Lewisburg. Though, of course, it is virtual, and we need to do that for safety reasons. It's all about keeping safe during this COVID era. But I want to say that I want to put a big thank you to everybody who was involved in putting on this virtual conference. This was a huge lift, and I want to especially thank the leadership of Dr. Hill and Courtney Herford and all the members of the Center for Rural and Community Health here at WVSOM, but especially our IT staff and our media services staff. They've done an incredible job of delivering this conference virtually to you, and I am really proud of them. And thank you for being out there and being part of this conference. It's important. So what I want to do this morning is talk to you some about WVSOM and our contributions to rural health care in West Virginia. I think, a lot of you know our story, but, what I have found as president going around the state is there's still a lot of people that truly don't fully know who we are. And so I thought this would be a good way to introduce you to us. I put up the mission of the school. And as you look at that mission, really the purpose of the school was to populate the rural areas of West Virginia with physicians, with primary care physicians. When you look at our mission, the first thing that jumps out at you is education is primary for us. It's the #1 thing that we do, and we do it incredibly well. And then, of course, as any medical school, we also are involved and have a research enterprise, and I will talk some about that. But the other thing that we're very involved in is community engagement. And if you look at our mission, we serve first and foremost the citizens of West Virginia. And we're really proud of that legacy. Of serving West Virginia, and especially serving in rural areas of the state. We were founded almost 50 years ago. In fact, 2022 will be the 50th anniversary of our founding. And, you know, really the four DOs that founded our school, Dr. Newell, Dr. Apgar, Dr. Wallington, and Dr. Bales, all of whom are deceased now, along with members of the West Virginia Society of Osteopathic Medicine, as well as our first president, Dr. Roland Sharp. I mean, they did an incredible thing by creating this school on this, the former campus of the Greenbrier Military School. And it's truly been remarkable what has been accomplished here in the 50 years that this school has been in existence. And so I show you this as to just underscore what the contribution has been. We are #1 in the state, the Appalachian region, the nation, and some people say the world. The world is undocumented. All the others are, by third sources, of being the leader for rural placement in the state, Appalachian region, nation. It's a remarkable achievement. So the vision of our founders, the vision of all of those DOs who recognized in the late 60s, early 70s, the incredible need in the rural areas of West Virginia. This school was founded, and now 50 years later, we lead. And we're proud of that. And it took a lot of people, a lot of partners, and you're going to see that what I want to show you is how some of the things that we're doing that I believe contributes to our success. And it's bigger than the school. It involves, as you will see, clinical partners all around the state and others who have made this happen. In addition to producing quality, caring, competent physicians for the state, we do other things, and I will share that as well. We've been recognized by U.S. News & World Report for decades for the work that we've been doing. And then I'm also really proud of being a great college to work for. This is a survey that our employees fill out, and they continue to give us feedback that we do things with quality here, with respect here, with inclusiveness here, you know, in terms of working together as a team to serve first and foremost West Virginia. So I am so proud of everybody who works here. But in addition to that, we're a huge economic engine for the state as well, and we take $9 million in our state appropriation, and we turn that into over $133 million each year that contributes to the state economy. And that isn't just Greenbrier Valley, as I'll show you. Basically, our economic impact is, in fact, statewide, just like all of our outcomes are a statewide impact. Of course, it's all about people. And we have great people here at WVSOM, great faculty and staff, but I also have a great leadership team. And many of you know members of my leadership team who have been here for many years, Dr. Hill, Dr. Ed Bridges, Leslie Bixler, Larry Ware, and Jeffrey Shawver that you probably have interacted with over the years. But I want to introduce two new members of my leadership team, and that is Dr. Linda Boyd, DO, who is our new Vice President for Academic Affairs and our Dean, our head Dean. Dr. Boyd hails from New Jersey. She comes to us from the Rowan University School of Osteopathic Medicine, where she was a Senior Associate Dean. She has worked both in allopathic as well as osteopathic systems. Very accomplished medical educator and medical school administrator. We're really thrilled to have her on board. She started in June. Dr. Boisiford, of course, we love Dr. Boisiford, and he is, actually this is his last week. He retires on Friday, and he has certainly served the school well. But we are we've just been blessed with incredible leadership, and now with Dr. Boyd as our academic dean. I also want you to be aware of our new Vice President for Integrated Marketing and Chief Communications Officer, Linda Boyd. Many of you may not have heard of Linda. She's from Charleston area. She had her own ad agency, the Arnold Agency. You may read her column. She's a nationally syndicated columnist on wellness, and we're thrilled to have Linda Arnold on board as well to basically tell our story and share what we're doing with WVSOM, because I really believe a lot of the things we're doing actually are models for other communities to improve the health of other communities. What you may not know, because it still comes as a surprise to people when I tell them that WVSOM is the largest medical school in West Virginia. And what I mean by that is we have the largest number of students. And so we have 800 plus students associated with our school. Every year we accept about 200 new students a year. And what's really sort of unique about WVSOM is that we are a sole purpose institution. Right now, all we do is we train people to become quality osteopathic physicians. And so we don't have other students that come here to be educated. We just focus on osteopathic medical education. We are thinking of expanding offerings and thinking of doing some different programs in the coming years, so you'll hear more about that in the future. In terms of where do our students come from? Well, they come from all over West Virginia and all over the United States. About 25% of our students are from West Virginia. 51 of our 55 counties are represented, and you can see this map from 2020. And then we also have students from all over the country that come to WVSOM as well. And so, as the state looks at, bringing people to West Virginia, I'm really proud of WVSOM as well as other higher education institutions that bring people to West Virginia so that they can get to know us and hopefully stay. As you can see, we, in terms of our student makeup, the statistics that are shown is from 2019, and you can see about 44% female, 56% male in that class. But I tell you, most years it's about 50-50. I just checked with the registrar, and this year, the class of 2025, we have 110 females and 106 males. So it runs back and forth between the male and female ratio. Most of our students come from the mid-Atlantic states, as you can see, but like I said, we have students as far away as Alaska and sometimes from Hawaii as well. I'm very proud of my students. I tell people all the time the lifeblood of the school are the students and our alums, and I'm so proud of all of them. There are many things that I'm proud of, but especially the giving hearts of our students and our alums. And this is a picture of our Student Day of Service this year. What we do is an orientation week in late July, and the capstone of that week is we invite our new first-year students to do a day of service in our community. I think part of our success is we select students who are service-oriented, who are focused on the community, and then we provide them with opportunities to work within the community, to get to know the community. And so this next video that I want to show you is footage that Media Services put together, and I'm so proud of our Media Services staff. But they put this together for our white coat ceremony that occurred in August. And it gives you some insight to some of the excitement around a white coat ceremony, which is a special ceremony for medical students to introduce them to their profession. But also it gives you insight to some of the activities, some of the fun social activities we did during orientation week, and also shows a little bit of the day of service. So I'll get to the next slide and roll the video. Day of service. These are fun orientation activities. I don't know if you can feel the emotion, but I just get emotional just watching that. It's just incredible. I'm so proud of our students. And it just gives you some insights to some of the activities. You know, last year was an incredibly tough year going through COVID. I'm really proud of this institution. We were able to keep people safe. We were able to keep the students on track and get promoted and graduated, and we kept employees working. I didn't lose any employees, and so I'm really proud of that. But it was an incredibly difficult year. It was also a year where we learned things. And certainly one of the things that I learned was how, while we knew mental health was really critical and was going to be highlighted, and thankfully, you know, big shout out to both our faculty as well as our Aspire staff who kept our students together. But the real need for, even at a medical school, for co-curricular activities, for activities, social activities. I felt so bad for the first year class who, you know, they didn't have a single class activity until the last day of class, where we held a white coat ceremony for them. It's just remarkable, you know. Tough year, really tough year. But, you know, this year, things are a lot better. You know, though things have gotten a little out of hand in the state, we've remained safe here in Lewisburg and throughout the state with our students. We have in-person class and labs, though we are wearing masks. One of the things I'm really proud of is our students are 99% vaccinated, as well as faculty. Staff is almost there. They're in the upper 80s, close to 90%. So I'm really proud of people. We're certainly taking all the precautions that are needed with mask wearing, social distancing when appropriate, certainly good hygiene, and I encourage others to do that as well. So in terms of our educational model, of course, med school is 4 years, and so the first 2 years, the students spend it on our Lewisburg campus. So we have about 400 plus students at any one time in Lewisburg. We have a beautiful campus, state-of-the-art facilities, and in certainly one of the coolest, if not the coolest town in America, but certainly one of the most beautiful places on this earth, the Greenbrier Valley. And so I encourage you to come visit us. You're always welcome, and please let us know. We'd love to show you around, and we'd love for you to get to know us. We're really big on collaboration, and as you'll see, a lot of what we do is we collaborate with others. So come and visit us. Come to get to know us if you don't know us already, and see what we have here. In terms of our curriculum, you know, I I think that's one of the driving forces. Curriculum really drives activity and drives the vision for the students. And so we use a patient presentation curriculum for the first 2 years. And really what that comes down to is learning in a clinical context, learning, your anatomy and physiology and biochemistry within a clinical context rather than as separate courses. And so it's an integrated curriculum, and it's designed to teach people in what they need to know in the context of how they're going to use it, meaning interacting with the patient. Of course, we have state-of-the-art facilities, and some of the images I'm going to show you show the quality of our classrooms and our campus. Certainly, where I think the cutting edge of medical education is while a lot occurs in our lecture halls and our labs where we do hands-on labs, our clinical evaluation center is really the cutting edge of medical education. It's where you use medical education technology to enhance the experience for the student. And, really, quite frankly, I think simulation is something that while we start using it within the first weeks of class, the reality is it's a way of teaching that teaches all adult learners, where you do hands-on learning. And so we have a simulated clinic in our clinical evaluation center and a simulated hospital. We've added ultrasound. We're adding virtual reality, and we've used electronic health records in our simulated clinic for a long time. And so, again, come visit us, check this out. It's an incredible facility where we're really on the cutting edge of education. Because the thing is, with simulation, you can simulate just about anything. It's just a matter of putting together the case. So in addition to simulating things like a shoulder injury, or somebody's having trouble walking, or they have stomach pain, or there's something, they're having trouble breathing. I mean, you can simulate anything for any age group. You can simulate birthing. We have 2 simulators that go through all the stages of birth. But you can also simulate things that deal with mental health, that deal with abuse, like child abuse or domestic violence. So it's a very powerful teaching tool, and I'm really proud of both our staff who runs it and the faculty who use it. It's accredited. We're accredited both for education and assessment. And we're one of the largest simulation centers associated with a medical school in the country, certainly the largest for the DO schools. So we're really proud of it. In addition, we do a lot of other things to educate our students. Certainly medicine is a team activity, and so we work with other institutions because, again, we don't have nursing students on our campus or PA students on our campus. We just have osteopathic medical students on our campus. So we open our facilities and we bring students, other health science students to our campus, so that our students and the students from like Bluefield State or Concord or Alderson Broaddus or University of Charleston can also learn how to work in an interdisciplinary team. Because that's critical for the care of the patient. As I tell my students all the time, it's all about the patient. It's all about caring for the patient. Really, when you think about it, it's all about caring for our neighbors and our communities. And so we work really well with other institutions to provide those experiences to our students. Certainly, they also get a lot of exposure to interdisciplinary teams when they do actual hands-on work in their 3rd and 4th year. Another teaching tool that we use is team-based learning. In fact, we created a special room for it. We call the Grand Hall, the John Manchin Grand Hall. Dr. Manchin, who was in the first graduating class and is still practicing in Fairmont, West Virginia area, named that hall. And it's incredible because you can put over 200 people in this hall. They can be all having conversations and you can hear each other. And so again, it's important to teach students how to work in a team and how to work together. And we do that. And so what they do in these groups is they actually learn how to solve clinical problems, because that's essentially what they do when they get out here. Is physicians are the problem solvers. So our newest building, though hopefully you'll be here on campus next year. We're building a new building as we speak, our new testing center, which should be completed hopefully in the next academic year. But before that one gets completed, our newest building on campus is our student center. It's been here for almost, I think, 6 years or so. And it's going to be the location of next year's West Virginia Rural Health Association meeting. We wanted to have it here this year. Unfortunately, because of safety reasons, we had to do it virtually. But next year, we'd love to have you on campus in person, and this is one of the facilities we'll be using for that meeting. And so the first floor was designed for our students, so a lot of student areas, student study areas, recreational areas, social areas, and then our food service. And I tell people all the time, the building is drop-dead gorgeous. It's a fantastic building, but the game changer was the food service. We have an incredible staff. The chefs are Greenbrier trained, and they can do everything from a complimentary breakfast to the most extravagant banquet you can think of. They've already done it. I've seen it. They're incredible. Right now, you'd be eating a delicious lunch. Hopefully, you're eating a good, delicious, nutritional lunch as I speak, but that's what you would be doing right now. So you'll have to come visit us next year and check that out. And here's our conference facility in the next slide. On the second floor, which we open up to the public. So if you need a place to have a meeting, Lewisburg's a great place to have a meeting, and our conference center is superb. This conference center can sit 1,000 people, auditorium style and banquet style. We can get it somewhere between 450 and 500. It can be divided up into 5 sections, and from a media point of view, it can do everything. I mean, it's wired. It's an incredible facility. So again, come and check us out. So I talked some about the first 2 years. Now I'm moving on to the third and fourth years, and this is really where I think our impact is evident, is the creation of our WVSOM statewide campus. So first 2 years, they're on our Lewisburg campus. In the third and fourth year, we take our students and we, through a lottery system, they get assigned to one of 7 statewide campus regions. So we have a region up in the north, our northern region. Then we have our eastern statewide campus. We have our central east and central west statewide campuses, and then our southeast, our south central, and our southwest. So we've divided the state up into 7 regions. We have both physical presence in all of these regions, as well as staff presence. We have a DO who is our regional assistant dean in each of these regions that oversee the education of our students, as well as a director and administrative assistants that help. As you can see, and what this is showing you is the numbers, and I don't have the key on here, is all of our hospital and clinic partners. So we, throughout the state of West Virginia, we're partnering with the major hospital systems, with all of the hospitals and the clinics throughout the state to educate our students. And so we have this statewide impact, and I am convinced it's part of the reason for our success. When you look at the clinical training in the 3rd and 4th year, you can see we're involved in 21 hospitals, 40 additional hospitals. So, I can't thank enough WVU Medicine, CAMC, Mountain Health Network, and then all the other hospitals, the for-profit hospitals, Raleigh General, Greenbrier Valley Medical Center, Princeton Community Hospital. The list goes on and on and on in terms of our hospital partners and our clinical partners who do such a great job for us and help with the training of our students. Realize that medical students delivers a significant number of healthcare hours. And we tabulate them over 1 million hours, our students, every year helping to deliver health care. As I said, we have staffing in these areas, but in addition, we have thousands of medical providers who help teach our students, mainly DOs and MDs, but others also involved in the training of our students and the education of our students. So we have close to 5,000 preceptors who are educating our students. And in addition to that, we also have very specific rural programming. We require our students to do rural rotations. Again, this is all part of our success of immersing our students in the rurality of West Virginia and the rural nature of our communities. They're embedded within these communities. They're working within these communities. But in addition to that, we're certainly involved in the rural health initiative at the state level and using those dollars to identify and to really encourage students to end up practicing in rural areas, as well as our local AHEC as well, and other organizations that we work with. And it's all designed to basically educate the student and to get them comfortable in terms of practicing in a rural setting. And as our record shows, many of them have chosen to do that. As I said, WVSOM has an economic impact that is statewide. While most of our economic impact, and this is from a 2020 study that we did, is in the southeast part of the state, with a lot of it going to Greenbrier County. The reality is because of our statewide campus, the fact that we divide the state up into 7 regions, we have an impact in each of those regions. And so it's an impact that is both financial, economic, in that, our students and we have staff living and working throughout the state. It's also in the healthcare hours that they're delivering to the state as well. And we've estimated that at over $1.5 billion. This is, of course, a third-party source that did this study for us. And so it's an incredible impact. And what I just want to say is WVSOM is contributing to the economy of your community, of your neighborhoods, and we're proud of that, and we're proud to serve. After graduation, medical students go on to residencies. You cannot be fully licensed, and you cannot practice medicine in the United States unless you go through at least a year of residency or more. And so one of the challenges, and so this slide shows you our residency partners. We certainly also have students who go into the residency programs associated with WVU and Marshall as well, and other programs. But I will say one of the huge challenges for the state is we don't have enough, and for the country actually, is there not enough residencies for the number of people graduating medical school. And the fact that we need more physicians, we certainly need more physicians. There's a real need to grow residencies. One of the reasons why graduates will leave the state is not having the residency that they want, and so we don't have enough residencies. Both in the state and actually in the country, and we're working on that to try to increase the number of residency opportunities available to our students. In terms of our alum demographics, we have about 4,000 graduates now that we've produced in the last 50 years. About a quarter of them have stayed in West Virginia, and then the remainder are in every single state in the United States. So like I said, we're a leader in rural primary care, and so we've populated rural areas around the country, but we have especially populated. And when you look at the footprint of WVSOM, basically our footprint is the entire state because we populate all those rural areas. I go out and about the state, and I can't tell you how many people talk to me and say, if it wasn't for WVSOM, I'm not sure how we would be getting medical care. So again, I'm so proud of our alums, all of our alums, but I especially am proud of the alums who have stayed in West Virginia and are making a difference. Our numbers speak for themselves. We're one of the leading producers of physicians for the state of West Virginia. Currently, 40% of the physicians coming out of the med schools are coming from this school that are staying in the state. We have led for a long time in terms of the production of primary care physicians for the state, and we certainly have led for decades now in terms of rural placement. Again, the vision of our founders, the vision of the West Virginia Society of Osteopathic Medicine, now the West Virginia Osteopathic Medical Association, was to populate the rural areas of West Virginia, and we're doing that. We're really proud of our alums. You can see some of them. During COVID and the opioid epidemic, we've been doing PSAs, and so Dr. Sherry Young, Dr. Themius, and Dr. Antolini, and Dr. Deering. Dr. Deering actually is from Michigan. He was our foundation board chair. But all the others, that I mentioned are here in West Virginia serving West Virginians. As I said, while education is the primary focus of WVSOM, certainly research is an important priority for the school, as well as our community engagement efforts. Our research enterprise continues to grow, and I would in fact say that we're at an all-time high in productivity, and will continue to grow our research efforts. Research extends from everything from biomedical bench research to clinical translational research to educational research and community-based research. So we're definitely involved. And we involve our students, and so here you can see some of the next generation of medical scientists that are getting influenced and getting opportunities at WVSOM to become researchers. These are images from a poster presentation. In addition to research is community engagement. I tell people all the time, a medical school should do more than just produce high-quality graduates who serve the community and do research to basically better understand how to battle disease and how to help people improve their health. But in addition to that, I think a medical school has a responsibility to actually try to improve the health of the communities they serve. And so we created a number of years ago the Center for Rural and Community Health, and under the leadership of Dr. Dreama Hill, this center has exploded. I mean, we are doing such incredible work. And the thing is while the work has incredible impact locally where the programs are being delivered, I really believe that what is happening at the center is they're creating statewide models that we can then spread throughout the state, as well as national and, in fact, international models of care and service to the community. As you can see this list, and this is not an extensive list of the types of things. We're doing research and scholarly work. Certainly we've been known for our community health worker training, our CHIRP training, which now level 1 is online. Check it out. It's for free, tell your communities about it. Certainly, we've been at the forefront for opioid response, as well as COVID response. Realize that the plan that the Attorney General's using for opioid abatement litigation funds was created by Dr. Hill and working with the AG staff. We're doing just so much to help reduce stigma, our anti-stigma campaigns, and so forth. And we even have a global initiative with Tanzania for our first-year students, and also helping them to improve their community response. As I said, opioid, this scourge is going to be with us for a long time, and so we're very involved in both prevention, treatment, and recovery. We've created toolkits. They've been so popular that we've created ones for the entire state. Many of them are county specific, and some are, regional. We just created a toolkit for children. Sort of sad that you have to do that, but education is really important in this area. And so in addition to that, we're doing all kinds of other programs to address this scourge. Same thing with COVID. This is the type of stuff that really makes a difference in your community. We help produce N95 masks. We supplied first-line workers with PPE. One of my favorite programs was the senior feeding program, where we got grant money so that we could work with local restaurants to create nutritional meals that then volunteers, many of whom were our students and staff, could deliver to seniors who were shut in when we had the lockdown back in 2020. And then they ran out of grant money, so we had a student who did a marathon event to raise more money, Feed More in 24. Just incredible things, it's such great, it's just incredible the type of work that is being done at the center. Certainly, we collaborate with anybody who's willing to collaborate with us, essentially, And here you can see a list. I doubt this list indicates all of our partners, but just gives you an idea of the scope and the breadth and the depth of our center, and the fact that we're touching a lot of other organizations and helping them. And we want to continue to do this. Again, it's all about collaboration. We're stronger when we work together, and I certainly that's been shown here in Greenbrier Valley. One of the things when you come to Lewisburg is check out our Klingman Center for Community Engagement, because this is where our local community engagement programs are being run out. It's in the center of Lewisburg. It's in Montwell Commons area where Hill and Holler and Amy's Cakes and Cones are located. Barn-like structure, it's one of Mark Bowe's barns, which is sort of cool. I think it was on his first season. You check that out. But, this is where we're doing our projects, our pilot projects, that could then blossom into statewide projects. Pictured here is Gwen Klingman. She's a real person. She ran an incredible place, feeding people. She fed the community. She was a person who believed in pay it forward long before somebody thought up pay it forward. She was providing people with meals who couldn't pay, decades ago. She's an incredible woman, has passed. Her cousin was our first president, Roland Sharp. There's a lot of stories about how the formation of the school happened in her back kitchen, so it's just an incredible story, and we thought it was so appropriate to name our community center after her, because she was the epitome of a person who was involved in her community and made a difference. And so, this is in addition to our graduates, in addition to our alums who serve the state, this is where WVSOM is truly making a difference. We're helping to improve the health of our communities. But just as important, we're teaching our students this. We're showing them, you know, we're a model for our medical students, we're a model for other communities, we're a model for other medical schools. You know, as I explain to people, we teach people how to grow food, how to cook food, how to manage their chronic diseases with lifestyle change. And we're teaching our students this. You know, so we're creating a generation of physicians who have a better understanding of these types of principles of health, which I think is so important. And again, it ultimately gets back to this, to our mission. You know, serving West Virginia, first and foremost. That's what we do. That's what we do here at WVSOM, is we serve others. We serve our communities, we serve our state, we serve our nation. And I am so grateful. I am so grateful. I can't thank enough to be the, you know, I'm so proud to be the leader of this institution and to be associated with this school, because we're doing great work and we'll continue to do great work. And I can't thank our students, our faculty, our staff, and all of our partner organizations that work with us to make West Virginia better. And I also want to do a big shout out to the West Virginia Rural Health Association, to their leadership and to what they're doing, and to every single person out there who's making a difference in their communities. I know you're doing that, and I'm just as inspired and proud of you, because ultimately it's about helping others. Thank you so much. God bless you, and go out there and do good. Thanks.